Pfizer is seeking emergency authorization from the FDA for its COVID vaccine for kids ages 6 months to 5 years old.
And that request coming this afternoon. Early Pfizer data shows that the vaccine, which is 1/10 the strength of an adult shot, is safe and produces an immune response. If approved, young children could start to get vaccinated by the end of February.
So many parents looking forward to this announcement, but many others still have some questions, so we're taking those concerns straight to an expert. Joining us now, Dr. Michael Chang, a pediatric infectious disease expert for UT Health and Children's Memorial Hermann Hospital. Dr. Chang, what are you saying to parents who might be concerned about the safety of the vaccine for their young kids?
Yes, I understand parents' concerns when it comes to their children. You know, all we want is the best for our kids. But what parents need to know is that we now have tens of millions of doses and tens of millions of kids that are fully immunized, and some kids who have even received boosters, and that we haven't seen any additional safety concerns from these vaccine doses. Parents should also know that for children less than 5 years of age, the dose of the vaccine is going to be even lower than what we were giving the 5 to 12-year-olds. And lower than what adults receive. And so we're expecting even less side effects from these lower doses and a really good safety profile from these vaccines.
Omicron showed that people who are vaccinated can still be infected. Why is it still important for kids to get the vaccine?
Right. And so at this point, we're shifting into a kind of a different phase of the pandemic. What we're really concerned with is preventing severe illness and hospitalization. Now, throughout this pandemic, children have fortunately been less likely to be hospitalized and less likely to have severe illness when compared to older adults. However, we still saw record numbers of kids hospitalized for COVID-19 during this Omicron surge. And so we're trying to minimize that risk and minimize the impact of this pandemic going forward for these kids. We also know that vaccination has other benefits against the multi-system inflammatory syndrome in children, which is a post-infectious syndrome that's unique to children and young adults. And we know that vaccination is protective against that.
Thank you so much for joining us again, Dr. Michael Chang with UT Health and Children's Memorial Hermann.